Damn it.
I'm gonna die unless you help me. A cat predicted my death.
Debbie the cat spends most of her time just prowling the halls, the queen of her own private world.
She was faking her seizures because her death was predicted by a magic cat. A magic cat! If this story gets any wilder, then this cat needs to change its name to Simba. Very excited to be reacting to House MD Season 5 Episode 18 here, Kitty. On this channel we are reacting to all 177 House episodes, and this will be episode 109. Let's see if I can get the diagnosis before House does as a doctor working in London.
Whoops. I had colds all winter. I'm a nurse, but could you run maybe a CBC or thyroid up?
She's urinating on herself.
She's having a seizure.
It's green.
Interesting. 35-year-old woman, head of nursing in an old age home.
You got con, methylcyaninium chloride. Notable side effect, green urine.
So your insight is based on discovering an anti-Alzheimer's drug. Her problem is phenol. It's still in some antiseptic.
Oh, finally! We know how Hulk serum is made, but on the off chance it isn't Hulk serum, what do we know so far? Well, she's had multiple colds over winter, green urine and a seizure, so there are a few possible causes. House thinks it's all related to phenol, which is mainly used as an antiseptic, but isn't used much anymore due to its toxicity when taking it by mouth, so I think that option is unlikely. A liver infection could cause bile to spill into the blood and find its way into urine, as well as weakening the immune system. That would usually cause jaundice as well, where the skin looks yellow, but we know House has a way of concealing obvious symptoms like that. There could also be an abnormal tract between the gut and bladder, leading to bile leakage directly into the urine, called a bile vesico-enteral fistula. Otherwise, there are a ton of drugs that could cause it, like amitriptyline, promethazine, metoclopramide, asparagus, and even some breath mints based on chlorophyll. Maybe the real symptom here is bad breath from acid reflux as a result of stomach lymphoma, which she's trying to hide with breath mints that is turning her pee green. That would be a wild diagnosis and would fit perfectly. Has to be my first diagnostic guess. Probably jumping the gun a bit prematurely there, although it won't be my first time. Let's get more clues.
She'd have to drink 5 bottles a day.
This is why I'm sure you won't have trouble discovering evidence of it when you search her house.
So why are you wasting Talb's time?
Test back?
Head CT was negative.
Damn it.
I'm gonna die unless you help me. A cat predicted my death. This is the cat, Debbie. She only sleeps next to people when they're about to die. She did it to me while I was sitting on my couch. Just watch this video.
House! Listen, soft breath sounds. He's his bronchospasm. Can't fake that.
Debbie the cat spends most of her time just prowling the halls, the queen of her own private world.
She was faking her seizures because her death was predicted by a magic cat. A magic cat! If this story gets any wilder, then this cat needs to change its name to Simba. Now the question is, what about the green urine? Was that fake too? I guess it was, since House said Taub is right, and Taub thought the urine was due to the dementia medicine on her desk. So the symptoms we're genuinely left with are tight airways and a feline prophecy. I must have missed that lecture. There are a ton of things that can cause bronchospasm, most notably asthma, which I've been seeing a lot recently. Asthma isn't exactly the most thrilling diagnosis though, so whoa, wait a minute. If she'd gotten well after the cat slept next to her, then maybe the cat's doing a little extra to make sure her prophecies come true. In other words, the cat is killing the residents, not predicting their deaths. That would be wild, but how could it do that? Well, infectious parasites could lead to a condition that mimics asthma called roundworm. This is the most common parasitic infection in humans, and usually people get it from coming into contact with the worm's eggs, like in human feces. What if the cat came into contact with those instead and is spreading this asthma worm like some kind of feline sprinkler? In a vulnerable population like in a nursing home, that could easily be one infection too many for Debbie's unsuspecting snooze sharers. That would fit here again so well and has to be my second diagnostic guess, and definitely matches the title here, Kitty. Question for you smart people: what makes a better pet? Dogs or cats? Answers down below.
When Debbie climbs on a patient's bed and goes to sleep, we call the loved ones and tell them to come in.
You think this cat story is nonsense, but you still think she's actually sick now? I'll give you 24 hours.
Maybe the cat didn't predict anything. Might have caused the deaths. It could be cat scratch fever or visceral larva migrants.
I could buy that. Why is some fancy CEO sending you a box of Cuban cigars? Is it related to your money worries? He lost almost all his money on the market last year.
You really lost all that money?
I don't care about the money. I just feel bad for Rachel.
There are no worms in the lungs.
What else can cause bronchospasm?
You actually think the cat is going to predict someone's death?
Cat is not going to predict anyone's death.
Look at Debbie.
Mr. Limpert, when you don't die tonight, you'll finally have done something good for the world. Do a methacholine challenge on Cat Girl. Check it out.
Well, team just completed a methacholine challenge, which came up negative.
You're joining me for goodbye smoke.
You got chickenpox shots that you only get in adulthood when you have a kid.
It was my stepson, Timothy. He was having his morning snack and he choked. He shouldn't have died.
Breath sounds soft to you, Doc. Hooray! You're officially sick. Churg-Strauss fits best. 13, start the patient on steroids for the Churg-Strauss.
To an outsider, House's actions are indistinguishable from those of someone who's trying to kill his patient, and yet it all comes from a place of kindness. Okay, maybe not kindness, more curiosity, but if solving the puzzle also helps the patient, then it's a win-win, right? Speaking of the puzzle, the team seems to have gone down exactly the same line of reasoning as me after Foreman's suggestion. Not bad, team, but that means I was wrong and I only have one diagnostic guess left to crack this. But we have a new symptom with her breathing difficulties, a rash. Considering how quickly the symptoms come and go, and now the addition of the rash, I'm tempted to say it's surely a type of allergy that's causing this. Churg-Strauss is like a cross between allergy and vasculitis, which could present similarly to this, but usually over a longer duration. She seems to have gotten both of these difficulty breathing episodes when she was stressed. An absolutely crazy diagnosis here could be exercise-dependent food-induced anaphylaxis. That's when some patients have a specific food like wheat, shellfish or celery and are absolutely fine at the time. Then, as soon as they're stressed or are exercising, the theory goes that the absorption from the gut increases and leads to loads of the allergen from that food leaking into the blood, causing a massive reaction. That would be so spicy, and she would just have to find out the food she's allergic to and avoid that to treat it. Simple. People can also get just exercise-induced anaphylaxis without the food-induced part, which pretty much stops them from exerting themselves. I've never heard of a better excuse not to go to the gym. I'm holding onto my diagnostic guess though until I get more clues than rash and breathlessness. While all this is happening, Taub is completely distracted as he's lost his family fortune trading the stock market. He seems like quite an impulsive fellow, first cheating on his wife and now this. With the whole crypto boom, I remember I came across a paper from 2021 that researched the relationship between people with known problem gambling and how often they traded the stock market. They researched around 800 people from the US who were self-identified active gamblers who also had stock market investments. They noticed that those who had worse problem gambling scores were also the ones most likely to buy and sell their stocks more frequently. The same group also showed significantly higher levels of overconfidence in their decisions. With both health and investments, doing the right things is important, but what's even more important is just not screwing up. You won't believe how much further than most people you can get by simply avoiding dangers. Many people do things that actively harm their physical or financial health regularly and then actively seek ways to try and improve it to compensate, and sometimes try to take shortcuts that are counterproductive in the long run. Like overeating and then going on fad diets, or trading using leverage and then trying to make risky investments later to make up losses. Humans are hardwired to hate losses, and that's backed by evidence, which is called loss aversion. People will get a lot more upset at losing $100 than happy at gaining the same amount. That's featured in Influenced by Robert Cialdini, which doubles as quite an interesting psychology, sales, and persuasion book. Now, let's get more clues.
I used to have an office like this when I was a plastic surgeon. I had an affair with the daughter of one of my partners. They signed a non-disclosure, I signed a non-compete. I wound up telling my wife anyway.
What do you think of the prototype?
It's amazing. You gotta make it a ½ inch smaller, though. And the girls would have to use 2 hands to hit the switch.
I am breaking out the really good stuff.
I went to the bathroom. My urine.
Green again?
It's brown. I didn't do anything, honest.
Brown could be fecal, fistula.
We checked.
If the green dye never left her system, what plus green makes brown?
Purple. Scopes don't work as well as pill cans. Give her one, find the tumor. Maybe you're a coward, maybe you're quitting. Either way, I'm screwed. And he's still breathing. We done?
Maybe she's just confused in this new environment.
Preacher in upstate New York added up some dates in the Bible and predicted Jesus' return. Every time he was irrefutably proved wrong, it redoubled everyone's belief.
How many times are we gonna watch this? There's no tumor.
Oh my God, Death Cat is attacking your legs. Skin cancer could have metastasized to the intestines. Check for melanomas.
We found spider veins on her back. They weren't there when she came in.
Those are the most beautiful spider veins I've ever seen. Almost too beautiful. They can have that delicate branching pattern, but usually it's much smaller and less defined. Hers look like it could be put on a canvas and sold at a gallery auction. So what could this new appearance mean? Well, they're associated with advanced liver disease, and we still don't quite know how they come about. We do know though that in advanced liver disease there are high levels of blood vessel growth signaling molecules that could cause these little guys to grow. One test for them versus other rashes is because these guys fill from the center. So you could get a tool with a blunted tip like the end of a paperclip and gently press on the center. With increasing pressure, you'd notice the branches lose their color, which doesn't happen with other rashes that would refill evenly rather than from the middle. Of course, it'd be hard to do that with hers though, since it covers her entire back. Either way, our new clues are liver disease and brown urine. The team think that if the green dye is still in the urine and the urine's actually purple, that would cause it to go brown. So what causes purple urine? Well, there's only one thing I've ever heard of, which is purple urine bag syndrome. So what is that? It's when a person can't get rid of enough of an amino acid called tryptophan and it reacts with a catheter bag. If the person pees directly without a catheter, it wouldn't go purple, as it's the interaction with the bag that does it, not the pee itself. Maybe whatever's in the urine bag could also be in the dye she took to turn her pee green. What would cause her to build up too much tryptophan though? Medications called monoamine oxidase inhibitors classically do it, but those are Parkinson's meds, so it wouldn't make sense that she'd be taking that. Cough syrup with dextromorphan could potentially cause it as well, and she said she'd had multiple colds recently, so maybe it is that. Doesn't quite work with the Here Kitty title though, but that could be a distraction. I suppose porphyria could be another option. It could cause a purple urine rash and potentially the spider veins with skin sensitivity to light, but this is a tough one. Kuttner is all distracted because of his superstitions here too, avoiding walking under the ladder. Taub seems like he may just get fired as he's missing the former life of luxury, but doesn't seem to have the courage to quit. So question for you smart people, what do you think is your most irrational thought or belief? What makes you think it? Answers down below.
Spider veins means Cushing's. You'd wake me up to tell me a symptom that's not killing her. What else is going on?
I think she's dying. Mr. Limpert died. The cat was right, House.
That cat sat on my lap and that cat knows something.
You're right. Sounds like he said, do you like cranberry juice?
Cheaper than fake blood. Chase do a venous sampling in her brain.
I want to come work for you.
I didn't mean to imply that I could hire you right now.
Let me invest in that laser scalpel startup.
I guess I could take you on at a smaller number.
I know it's not going to change my life overnight. I just need to start changing it.
Your patient had cardiac arrest during the venous sampling.
What about the ACTH?
Slightly elevated. Are you sure that it's Cushing's?
I want the surgery.
I'm quitting.
You got a new job?
No.
Well, you're not quitting.
Here, puss.
Whoa, wait a minute. The cat jumped on the laptop. What would be attractive in a laptop that would also be in patients who are about to die? Heat. The cat just wants a bit of warmth. That means our patient doesn't have Cushing's. You see, the hormone that Chase was measuring from the pituitary gland called ACTH can also be increased as a result of a stress response to infection. So it could be that the cat is more sensitive to finding fevers than a thermometer. So what infection could cause Our Lady to not be long for this world? She could have something called walking pneumonia that would be quite difficult to treat and does classically have outbreaks in nursing homes. It's really difficult to diagnose as the bacteria doesn't stain properly with a normal blood culture. You have to specifically look for it either in the blood or the urine. The usual symptoms you can get include an ongoing cough, feline warming fevers, breathing difficulties, and tiredness. When it gets really bad though, then things can get crazy, triggering asthma attacks, swelling in the brain, breakdown of the blood, and kidney dysfunction that could explain the brown urine and recurrent breathing difficulties. The high steroids as a result of the chronic infection could explain the spider veins. That would work so perfectly well. That's gonna have to be my third and final diagnostic guess. We are locked in. If I got walking pneumonia from a cat on a laptop, that would be wild. Let's find out.
Neil doesn't work here anymore.
He's the CEO. I'm investing with his company.
He doesn't have a company.
Where is he?
He's in custody. Did you give him the money yet?
No, the cat was not predicting deaths. It was just trying to keep warm. It's what causes flushing, mimics every Cushing symptom, except central body obesity.
A corticotropin-producing carcinoid tumor of the intestine.
What's the OR extension number? Just curious.
Thank you.
You're about to cut out a piece of your brain just to chase some crazy superstition. I stopped at cat pee on my chair.
Blood on my face?
Fake blood.
Damn, I was thinking for a moment paraneoplastic syndrome when Chase mentioned, are you sure it's Cushing's? But my brain decided to go off-road at the cat staying warm epiphany. So close, yet so far. Interesting though that Taub dodged a bullet with that one. He was about to hand away what was left of his life savings but narrowly avoided defeat. I have to say this episode is quite a masterpiece. The cat superstitions and the side parts about Kuttner's superstition and Taub's finances adding to a challenging case. 8.3 out of 10 entertainment, 7.4 out of 10 accuracy, 8.1 out of 10 diagnosis. This episode doesn't make full sense until you watch the previous one where a patient makes house look polite.